Check on your elderly or chronically ill neighbors and loved ones. Older people, those over 60, and those with underlying health conditions are at higher risk of developing severe symptoms from COVID-19. The CDC currently recommends that people in these groups stay home as much as possible to avoid getting sick. If you have older or chronically ill friends, neighbors, or family members, contact them regularly by phone, text, or email to see how they are doing and ask how you can help. Drop off packaged food for people in quarantine. If you know anyone who's stuck at home because of the coronavirus, either because they are sick or because they're at risk of catching it, offer to help by bringing them food and other supplies. Let them know you are coming ahead of time, then drop the food off at their door or on their porch. Knock or ring the doorbell so that they know you've made the delivery. Check with local charities, food banks, shelters, schools, and religious organizations to find out if any groups in your area are looking for volunteers to make food deliveries. Donate blood if you are healthy and able. With more and more people falling ill, hospitals and blood banks are facing increasing blood shortages. If you're currently healthy and have not been exposed to the coronavirus as far as you know, consider donating blood, platelets, or plasma at your local hospital or donation center. Don't donate blood for at least 28 days if you've recently traveled to an area where the coronavirus is especially active, including China, Hong Kong, and Macau, Iran, Italy, or South Korea. Give money to charities helping coronavirus victims. Charities and other nonprofit organizations are working hard to help those most affected by the coronavirus outbreak. One of the best ways to support these organizations is to donate money, which they can use to purchase critically needed supplies or provide relief for people who are struggling financially. Do a search for local food banks, relief organizations, places of worship, and other groups in your community that are seeking donations. Offer to help parents affected by school closings in your area. With so many schools closing in an effort to contain the virus, a lot of working parents are facing significant hardships. If you know families who are struggling to work and care for their school-age kids due to the coronavirus outbreak, ask how you can help. Watch the kids if you think it's okay to visit. Buy groceries and supplies for them. Offer practical help for families that are struggling. Whether you're dealing with illnesses, school closures, or financial hardships, they could use good neighbors. Do chores for them. Pick up groceries and supplies. Offer a listening ear. Cut back on streaming video during school hours, especially if you live in an area with lots of kids or college students. While it may be tempting to binge watch a show all day, keep in mind that some of your neighbors may be attending school via video. Reducing bandwidth usage can make the internet more reliable for students who live nearby. Avoid hoarding masks and other essential healthcare items. While it's a good idea to be well prepared during a global crisis like the coronavirus outbreak, avoid panic buying or hoarding supplies. Buying up masks, hand sanitizer, and other medical supplies will only make it harder for medical care providers and people who are already sick to get access to these items. Try to assess which supplies you will actually need, and how many, before you head to the store. Get information from reputable sources like the CDC and WHO. Staying informed is a great way to help yourself and others during the coronavirus outbreak. Stick to getting your information from trustworthy sources, such as medical research institutions and government health organizations like the Centers for Disease Control and Prevention. Share useful tips and information on social media and one-on-one. If you find information that you think may be helpful to others, such as advice on how to prevent the virus from spreading or updates on actions that people are taking in your community, don't hesitate to share it. Post on Facebook or Twitter, send an email, or call up your friends and family to pass it along. Provide links to back up anything you share. If you share information with others, make it easier for them to evaluate your claims by citing your sources. Always direct them to the article, website, or other source where you got your information instead of just expecting them to take your word. Similarly, always ask for a source if someone else shares information with you, especially before you pass their info along to anybody else. Correct others when they share misinformation. If you see someone sharing information that you know is false, correct them in a calm, non-judgmental way. If they're resistant to being corrected or contradicted, you can also ask questions to encourage them to think critically about the source of their information. Offer a source that helps refute their information or provides accurate alternative information. Stay calm and avoid spreading fear. While it's natural to be worried during a major disease outbreak, panicking and spreading fear won't help anyone. Take measures to manage your own anxiety and reassure others who are scared. You can help reassure others by sharing helpful, reliable information about COVID-19 and how they can protect themselves. Express gratitude to those who are helping. Recognizing the positive actions of others will encourage them to keep up the good work. Studies also show that publicly acknowledging the work of everyday heroes can inspire others to take positive action. Say thanks to people who are making a difference and spread stories about those who are helping. For example, if you read a news story about someone who is volunteering to deliver supplies to sick people in your community, post it on social media. You can also send an email or make a call to thank them personally. Show compassion for people from affected areas and avoid spreading blame. Some people react to disease outbreaks, including the coronavirus, by spreading fear and stigma about specific groups of people. Help stop stigma and discrimination by showing your support for people from the areas most impacted by the virus. Learn the facts about how the virus is spread and share that information with others. Advocate for good safety practices at work and school. Organizations in your community can play a big role in protecting the general public. Even if you're not in charge, don't hesitate to speak up if you have ideas about how your school, workplace, or other organization can help. Wash your hands frequently with soap and warm water. Washing your hands is one of the easiest and most effective ways to protect both yourself and others from COVID-19. Wash your hands anytime you interact with others, touch surfaces in a public place, go to the bathroom, prepare or handle food, or cough or blow your nose. Wash for at least 20 seconds with soap and water, and make sure to wash all surfaces of your hands. Cover your nose and mouth when you cough or sneeze. Health experts believe the coronavirus is spread when people inhale droplets of liquid from other people's mouths and noses. Even if you don't think you have the virus, set a good example and protect others by practicing good respiratory hygiene. Cover your nose and mouth with a tissue or the crook of your elbow when you cough or sneeze. If you use a tissue, throw it away immediately in a lined garbage can and wash your hands with soap and water. Stop touching your face. Touching your face increases your chance of infection. Try to put your hands somewhere else if you notice yourself reaching for your face. Disinfect high-touch surfaces in your home or workplace. People can get sick if they touch surfaces that are contaminated with the coronavirus. You can help protect yourself and others by regularly disinfecting surfaces that come into frequent contact with people's hands, such as doorknobs, light switches, and counters. Use a disinfectant such as isopropyl alcohol, at least 70% concentration, household bleach, or Lysol. Avoid handshakes, hugs, and other close physical contact in public. Even if you don't think you're sick, you can help protect others and yourself by practicing social distancing. Don't shake hands or hug people, and try to stay at least 6 feet, 1.8 m, away from others as much as possible in public places. It's especially important to maintain a distance from other people if you or the other person has symptoms such as a cough or fever. Stay home if you're sick. If you feel sick, protect others by avoiding contact as much as possible. Stay home unless you have to seek medical care, and avoid taking public transit if possible. If you have to see your doctor, call ahead to let them know if you have symptoms such as a fever or cough. Take extra precautions when caring for a sick loved one. Keep them isolated from the rest of the family as much as possible, and keep every family member at home. Wash your hands more often. Isolate the sick person as much as possible. If they feel lonely, encourage them to text, call, or video chat with family members instead of talking in person. Follow the advice of public health officials and your doctor. Public health officials are implementing special measures around the world to help contain the virus. If you receive instructions from your doctor, local public health department, school, or workplace about how to protect yourself and your community, do your best to comply. This will help keep you, your family, and the most vulnerable members of your community safe.